So a patient just came in and their complaint was they had some tingly stuff going on in the hand, and this can be fairly common. And this patient actually had what's called thoracic outlet syndrome, and basically they had an arterial version of it where they had some tight muscles in and around the shoulder and the neck that was compressing an artery going into their hand, and it was off and on giving them some tingly stuff throughout the day. So we did some manual therapy, we did some adjusting, we got things going, but I wanted to share with you their homework, and that way if you maybe have this stuff going on, it helps you out a little bit. So here are the two things we sent them home with. So the first thing we worked on was using a ball. You can use your hand too. I like using a ball though, and basically working on the pec muscle. So I'm going to take this guy and I'm going to sit up nice and tall, put it kind of right here on my chest, and then I'm going to compress it, pull gentle pressure toward your sternum this way, and then while I'm holding that, I'm going to take my arm and I'm going to take it through a range of motion. And then each time I come down, I'm just going to kind of reset that a little bit and go back and forth here. All right, so hopefully now that we've got some tension out of that guy, I like to take it through just a nice passive stretch, just kind of open that up a little bit. Basically with this doorway stretch, I'm gonna change the angle on my arm based on wherever I feel tension, and most often it's right around kind of this angle here, not necessarily 90 degrees, but a little bit higher usually. Then I'm just gonna step through the door, I'm gonna kind of rotate my torso out there, and I'm just gonna kind of open up that chest a little bit. This is a really great way to start. There's lots of different fancy stuff we can do, but this is a great starting place to kind of do a little bit of a 1-2 punch, getting in there with the ball, and then taking it through a range of motion. Give it a shot, and I hope it helps you out.